Hi, good day. My name is Robert Hendricks, and today we're going to introduce you to some of our employees at Health Systems Trust.
We go out to different facilities, we analyze data with the outcome of improving data quality.
Most senior researchers manage between 4 to 5 projects at any given moment. We also manage the staff under the projects and any project-related activity like budgets, liaising with external stakeholders, doing reports, sometimes journal articles.
Work in the facility to mentor and coach data capturers as well as to report to operational manager in the facility.
We are busy with monitoring the project, and then we monitor it through looking at the progress of the report through the reports of the different districts that we are supporting.
Assisting with implementation in the districts, sub-districts, and also in facilities.
I'm working with all the teams within the SA Show. We mobilize these communities, we empower them, we work as catalysts as well.
I interpret concepts that are defined by policies to make them possible for operationals or operational managers to actually manage and implement.
I am into data analysis, which is mostly on the quantitative part, although I do assist a lot also in the qualitative reports.
I work in the ANC department. I test pregnant women and mothers and children.
It's a way of transferring skills or facilitating certain quality improvement plans that we need to do at facilities.
Assist the project manager and the project staff to build a framework for them to operate within, following the standards and the procedures of the organization.
Someone who is very, very analytical, someone who sees through things.
You must have at least done a course on HIV and AIDS. You should know your history and information concerning HIV and AIDS.
I think it's critical that at least you have a qualification in community development.
I think having an analytical mind, being able to analyze data and also use the data to make decisions that can improve data quality and improve the health system.
This particular job needs a person with the research skills, a person who knows how to deal with people with a psychological background.
You need to have a health background. You need to have a diploma or a degree in health or anything related. You also have to have a broad understanding of HIV, TB and HIV.
You need to have a little bit of knowledge of working with people. Social sciences will do. Public health degree would also be sufficient.
Public health medicine training is very useful, and to have some sort of on-the-ground experience to understand the healthcare system in South Africa.
For qualification, you need to have it can be a master's degree in monitoring and evaluation. The skills, you have to be a very good analyst.
You definitely need to have administration, information systems and communications. They help quite a lot.
Almost every activity that I'm involved in, especially when we get to meet the deadlines for the reports that we are supposed to submit, and if we come up with the right product as expected by the stakeholders.
Knowing that what I'm doing is changing people's lives, because as much as we use data, behind the data is people. So when I see the figures, I see people.
When after a session people come to thank me for simplifying the methodologies that will enable them to reach the outcomes.
Being on the ground and engaging with people in various parts of the country, but also when a project is complete and we were able to fulfill our deliverables and where our outputs were done and done well.
Public health is very close to my heart. The little input or contribution that we make, it's not basically for me or the people we are supporting. I think we have a much more broader, a bigger picture that we need to see, because it's all about the will of people. It's all about
being able to educate a mom and to help her and to let her know that she's not alone in this process that she's going through with HIV and AIDS.
It's when I see these facilities and the districts transformed.
I think interacting with the team who are hands-on, getting to interact with them and then them sharing the experiences on how they are implementing the program, I think that is the best satisfaction ever.
Knowing that the support that the administration unit offers to the project staff enables them to reach their objectives and goals.
Absolutely.
HST have been doing a tremendous job.
Definitely. I definitely think that they're making a difference.
Most definitely. HST is a very reputable organization.
HST is in a unique position.
Community participation and engagement.
I believe we're making a difference because we use an integrated approach.
We have a good marriage of academic knowledge, but also on the ground experience.
They are the ones that support between the translation of policies to implementation,
helping us make our jobs easy by giving us the tools that we need to work with.
We have re-engineered the health system for the better.
HST is well placed to achieve that overall objective of quality healthcare.
And that on its own, it brings me a great pleasure to be part of HST.